morning, my name is Jennifer Vellin. I'm a nurse practitioner student at the University of Texas in El Paso, and today we're going to be doing a comprehensive assessment. Entering the room, my patient's sitting upright. She's in no acute distress. Her color is pink. I'm just going to ask her level of consciousness to determine that she's competent for the exam today. Can you tell me your full name, please?
I'm Tina Bachner.
Perfect. And why are you here today?
I'm here for an annual exam.
Perfect. Can you tell me your date of birth?
3/31/85.
Wonderful. So her speech is coherent. She's conversational. The symmetry of her face is normal. I'm just going to feel the contours of your scalp for any tenderness, deformities, or breakdown, and the contour is normal. Do you have any pain?
None.
Right. There's no lumps, bumps, or bruising when I feel there. I don't see any edema or masses. I'm just going to test cranial nerve 7 first. So if I could have you smile. Okay. And then frown. Show your teeth. Good. Close your eyes tight. Open them big. Good. Puff out your cheeks. All right. Everything expected there. I'm gonna just test cranial nerve 5 next. So close your eyes. Do you feel me touch you here?
Yes.
Okay. Does it feel the same on both sides?
Yes.
And how about here?
Yes.
Good. And then I'll have you just open your mouth and close your mouth. Good. And here. Okay, so sensory and motor of cranial nerve 5 is intact. I don't feel any clicks or abnormal movements or tics. I'm going to next just palpate the cervical lymph nodes, so preauricular, postauricular, submandibular, submental, the anterior chain, posterior chain, occipital, and then the subclavian. Supraclavicular. Go ahead and take a deep breath. Good. And I don't feel any hard lumps or bumps. There's no tenderness, which is what you would expect in a healthy patient. Moving on to her neck, I'm just going to note that her trachea is midline and take a quick listen over the top of the trachea. Perfect. And there's no stridor. I'm going to just palpate the thyroid. Go ahead and look up and swallow. Good. And there's no nodules, lumps, bumps, or goiters when I palpate the thyroid, so all expected findings there. Moving on, we're going to take a look at your eyes. So I don't see any protrusion or deviation. The patient isn't cross-eyed, so cranial nerve 2 is intact there. Looking at her eyebrows and eyelashes, the hair distribution is expected. There's no crustiness or scaliness or any periorbital edema. The cranial apparatus is moist and intact. There's no crusting there. I'm going to have you just look up. I'm going to touch you here. The conjunctiva is nice and pink. The sclera is white. I don't see any clouding in the cornea or lens. Let's see. I'm going to move forward and just test your visual fields. So looking straight at me, I want you to point where you see my fingers. Good job. And then keep looking straight at my nose. I want you to follow my finger with just your eyes. And this is testing cranial nerves 3, 4, and 6, and all of her visual fields are intact. I don't see any extraocular movements. There's no nystagmus. Okay, next we're just going to do the pupillary response. So I'll use my ophthalmoscope. My kiddos got into that one. Okay, so shining a bright light, look straight at me. I'm gonna make it a little bit brighter. Okay, good. And her pupils are 3 and brisk. I do see the consensual light reflex on the other side. They both equally react to light. I'm gonna have you keep looking straight ahead. I'm just gonna do a fundoscopic exam. And I'm going to inspect the optic disc. The margins are sharp. I don't see any AV nicking, cupping, or bulging. Same thing other side. Okay, and here we have sharp disc margins, 2 positive light reflex. No bulging or paleness that I would be concerned about. We're going to defer the visual acuity. We're going to go into the cranial nerve 2 is good to go. Next, we're going to move on and we're going to do your ears. So I'm gonna have you just, with your right hand, cover your ear. I'm gonna say a word to you. I want you to whisper it back.
Hospital.
Good.
Elephant.
Good. So gross hearing is intact, but for the purpose of our exam today, we're gonna go ahead and just complete the Weber and Rhine test. This will be for cranial nerve 8. Okay, so I'm gonna place the tuning fork just here. I want you to tell me if you feel the vibrations symmetrically on both sides, okay?
Okay. Yes.
Okay, perfect. And then we're gonna do the Rhine test, which is bone conduction. So whenever you feel the vibrations stop here, just let me know and I'm gonna move it here.
Okay.
And you should be able to still hear it through the air.
Okay.
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 Can you hear it?
Yes.
Same thing other side.
Okay. Yep, I can hear it.
Perfect. So cranial nerve 8 is intact. I'm going to then just take a look. I could see that the auricle has no redness. I don't see any tophi, lump swelling, or deformity there. Is there any pain when I pull?
No.
Okay, good. I'm gonna just take a quick look inside your ear, okay? And I don't see any foreign bodies, lesions, or bleeding inside of the external canal. The tympanic membrane is a pearly gray. There is a positive light reflex. It's not bulging or pale. There's no signs of perforation. Okay. And looking at the other side, no redness on the auricle, no deformities, lumps, bumps, or masses. I'm just going to take a quick look here. Is there any pain when I touch you?
No.
Okay, perfect. Okay. And same thing here, there's no foreign bodies. I don't see any cerumen impaction. The tympanic membrane over here is a pearly gray. I can see the light reflex. The membrane is nice and mobile. So everything looks really good with your ears today. Okay. Moving on, we're going to test cranial nerve 1. So I'll have you close your eyes. And I want you to just tell me what you smell.
Cinnamon.
Perfect. Okay, and just looking straight ahead at your nose, I can tell that there's no septal deviation, there's no deformities. I'm just gonna take a look at the inferior surfaces, and I don't see any obstruction or epistaxis or rhinorrhea. I'm just gonna have you occlude one nostril, take a deep breath in, and then the other side. Perfect, nice and patent, and I'm just gonna look for any polyps or nodules. The mucosa is nice and pink. I don't see any lesions or bleeding or ulcerations. And then I'm just gonna feel here across your sinuses. Is there any pain?
None.
Okay, how about here?
No.
Okay, perfect. Next we're going to just move on to the mouth. So looking at your lips, they're symmetrical, they're pink. There's no dryness or cracking that I'm concerned about. I'm gonna have you just open. Okay, and the mucosa is nice and pink. The dentation is adequate. Looking at the hard palate, I don't see any deformities or malformations. The gingiva and the you can relax for a second. No, you're perfect. The interdentillary papillae are non-swollen. I don't see any bleeding. There's no missing teeth. Okay. And taking a look, I'm just going to test your cranial nerve 12. So go ahead and stick out your tongue, move it to the left, move it to the right, and then move it up and down. All right, and that is intact. And when she did that, I didn't see any lesions on her tongue. I'm just gonna have you lift it up one more time. Good, nothing to be concerned about there. All right, next I'm gonna take a look at the very back. We're gonna test cranial nerves 9 and 10. So you say ah.
Ah. Ah. Ah.
Perfect. And the uvula rises. I don't see any exudate or swelling posteriorly in the pharynx. And then one more time, I'm going to have you say ah.
Ah.
And swallow. Okay. and everything rises symmetrically and falls symmetrically. And along the exam, we've been noting that her speech is clear, so cranial nerves 5, 7, 9, and 12 are intact there. We're going to move on to our neurological exam. So with your short-term memory, could you tell me the 2 words that I whispered to you earlier?
Hospital and elephants.
Perfect. And long-term, could you tell me who the president is?
Joe Biden.
Yep. How about before that?
No, Donald Trump.
Before that?
Obama.
Very good. For calculation, can I have you count back from 100 by 10s?
100, 90, 80, 70, 60, 50, 40, 30, 20, 10, 0.
Wonderful. And abstract thinking, if I could have you tell me, how is an apple and an orange similar?
They're both fruits.
But how are they different?
One is red and one is orange.
Perfect. Going to note that she doesn't have any involuntary movements. Her muscle tone is normal. There's no atrophy. For cranial nerve 11, I'm just going to have you shrug your shoulders up and down, and then I'm going to have you rotate your neck as far as you can to the side and to the other side. Okay, and up and down. Wonderful. I'm going to have you bring your shoulders up to the side. I'm going to resist you. Good. Don't let me push you down. Okay. Wonderful. I'm going to have you bring your arms out. Close your eyes. And there isn't any pronator drift when she does that. I'm going to have you open your eyes for just a second. I'm going to have you, like you're flexing, you're going to do a bicep curl. Okay. I'm going to pull against you. Don't let me. Good. All right. And then I'm going to push against you. Don't let me. So for her shoulders and for her elbows, her strength is 5 out of 5 bilaterally. There's no abnormal movements. I'm going to have you bring your palms out. Okay. I'm going to try and push your fingers in. Okay. And then flex your wrists up. I'm going to pull against you and then bring them down. Okay. Wonderful. And then give me a good squeeze. Good. All right. Next, I'm going to have you just with your thumbs tap here and then go down your fingers and then back up. Good. So her movements are symmetric, they're quick, they're accurate. And then with your hands out one more time, close your eyes. I want you to put your finger to your nose. Okay, other side. Perfect. Go ahead and relax for just a second. I'm going to next just test the hip strength. So lift this leg up from the table if you're able to. I'm going to push you down. Good. Okay, same with this side. Perfect. So 5 out of 5 bilaterally. I don't see any atrophy in the quadricep. I'm going to have you just flex here. Okay, I'm going to push you down. Don't let me. Okay, and then relax. Okay, I'm going to bring you up. Don't let me. Okay, flexion and extension at the knee is 5 out of 5 on that side. We'll do the same thing here. Bring it up. Don't let me push you down. Okay, and then I'm going to hold you. I want you to bring it back. Perfect. Moving on to the ankle, we're going to do the same thing. I want you to flex here. Okay, don't let me push you down. Okay, and then push me away. Perfect. And then same thing on this side. Wonderful. And while I have you sitting here, I'm going to have you do just a quick heel to shin test, which means you're going to take this leg up and like you're drawing a line from your knee down to your ankle. I want you to trace up and down with your other foot.
Okay.
Perfect. And then other side. Perfect. All right, next test we're going to do, I want you to have your palms out. Just have them resting on your legs and then flip them over. And then I want you to repeat that, but every time get a little bit faster. Good job. All right, so her coordination is intact. Her muscles are symmetric, they're accurate, they're quick. We already did the finger to nose. Next we're going to test sensory. If I have you just holding your hands out, I'm going to place an object in your hands. Close your eyes. Tell me what you feel.
Can I manipulate?
Yeah, just with one hand.
Oh,
Perfect.
it's a key.
Okay, and then we're going to test with the other side.
It's a coin.
Perfect. So graphophysia is intact. I'm going to draw a shape. Tell me what shape you feel.
Circle.
Okay.
It's an X.
Yes, perfect. So serratus is intact. I'm going to have you keep your eyes closed. Tell me if your fingers moving up or down.
Up. Down. Down.
Okay.
Up. Down.
Okay, so proprioception is intact. You can relax your hands for just a second. You're doing great. I'm going to test just your sensory function next. So, keeping your eyes closed, I want you to tell me if you feel sharp and where you feel it, or if you feel dull and where you feel it, okay?
I mean, it's kind of hard to say through the sleeve. Do you want me to?
That's okay. Here, to the side.
It's sharp on my upper arm.
Okay.
Sharp on my upper arm.
Do they feel the same on both sides?
Mhm.
Okay. And how about here?
Soft on my forearm.
Okay.
Sharp.
Good.
Soft. Sharp.
Okay.
Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp.
Okay, and did everything feel the same from one side to the other?
Mm-hmm.
Okay, good. I'm gonna touch you. It's gonna be cool metal. I just want to tell me if it feels the same on both sides.
Ooh. That's cold. Yeah,
Okay.
same. Same. Yeah. Uh-huh. Yep. Mm-hmm.
And then I'm gonna tell you what sensation you feel just down here. Do you feel it vibrating?
Yes.
Does it feel the same on both sides?
Mm-hmm.
Okay, wonderful. I'm just going to test your walking next, so I'll have you actually up from the table. Okay, so walking towards me, just a casual walk. I'm going to just take a look at her gait. Go ahead. Okay, and her hip swing is normal, her arm swing is normal, her knees flex appropriately. Okay. Coming back towards me, I want you to walk on your toes, please. Okay. Good. And then walk back the other way on your heels. Perfect. And then the last time I want you to do like a heel to toe in a straight line, like a sobriety test. Okay, passed with flying colors. And then just standing, looking at the camera, I want you to have your feet close together, your hands at your side, and close your eyes. Okay, and she doesn't lose her position, so that's a negative Romberg's test, which is expected. We're gonna go ahead and move on. We're gonna do the thorax and lungs, so you can actually take a seat here. Okay, and surveying her respiration, she's not in any respiratory distress. Her breathing is symmetric, it's regular. Her color is normal. Looking at the anterior posterior diameter, I don't see any barrel chest or any deformities there. I'm just gonna feel for for your respiratory expansion. Take a deep breath. Good, and it's symmetric. And same thing other side. Good. And any deformity, any tenderness when I touch there?
No.
Okay, perfect. I'm just gonna percuss, so you're gonna feel me tapping, okay? Okay, and I don't feel any areas of dullness or consolidation when I percuss. The sounds are resonant. I'm going to do the same thing on the posterior. And lung sounds are resonant throughout all the lung fields. I already palpated, so I'm going to next auscultate. And then just take a nice breath in and out. Okay. And breath sounds are vesicular. I'm going to do the same thing on the posterior. Lungs are clear to auscultation bilaterally through all the fields. I don't hear any crackles, wheezing. I'm gonna have I'm gonna listen one more time. I want you to say 99 whenever I say go, and I'm just gonna test your transmitted voice sounds, okay?
Okay.
Okay, go.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and transmitted voice sounds are equal bilaterally. We're gonna move forward and do just a quick cardiovascular exam. You're gonna, let me just feel on your neck. I'm gonna be palpating the carotids. Okay, and they are 2+, which is expected. We're gonna listen with the bell for any bruits. There are none. I'm going to listen over your chest. I'm going to listen to your heart in all the different places. So beginning with aortic, pulmonic, Erb's point, tricuspid. Okay. And before I listen, I'm just going to palpate for any heaves or thrills. I can feel the point of maximal impulse, which is mid-clavicular fifth oscillary space. I don't see any precordial movements, no heaves or thrills. Her S1, S2 is regular. There's no splitting. I don't hear any extra heart sounds. There's no gallop or murmur, but I'm going to listen with the bell of my stethoscope just to be sure. Just over the same places. So no murmurs throughout any of her valves, and that's also where I would take the time to calculate her apical pulse if we were going to count for the full minute there. All right, we're going to move on and do a quick abdominal exam and then musculoskeletal, and we're going to go ahead and hit those deep tendon reflexes when we go there, okay?
Okay.
All right, so I'm going to have you lay back. There's a pillow here for you. If you want, you can scoot back on the table so that your legs are out flat. And looking first, I'm just gonna bring your shirt. Is that okay?
Oh yeah.
Okay. All right. The abdomen is flat. The color is pink. I don't see any abnormal masses. There's no scars. There's no striae. I'm going to first auscultate. I'm gonna listen first at the level of the aorta, just adjacent to the umbilicus. And I don't hear any bruits there. I'm going to auscultate over the renal arteries. Okay, and the iliac arteries. And I don't see any, I don't hear any turbulent blood flow or any bruits. I'm also gonna take the time to just auscultate bowel sounds with my diaphragm now. Okay. And bowel sounds are normoactive in all 4 quadrants. I'm going to, I'm just gonna tap tap. I'm gonna percuss first over the 4 quadrants. Over the urinary bladder, the sounds are tympanic there. I'm going to percuss also just to estimate the size of your liver, okay? Okay, and I can feel the area of dullness that extends just about a centimeter below the costal region, so I would give about 8 centimeters, which is within a normal range. I'm also going to percuss for the spleen. So I'm going to locate the infrasternal notch and follow the costal region all the way to the anterior axillary line to locate trough space. And when I percuss there, I'm getting a tympanic sound, which is normal because the patient doesn't have any enlarged spleen at this time. I'm gonna touch you just with one hand first, nice and light. I want you to tell me if anything hurts. Okay, and then I'm just gonna go a little bit deeper, all right?
Okay.
Okay. And I don't feel any masses, lumps, bumps, or deformities. The patient isn't guarding, there's no rigidity, no rebound tenderness. I'm gonna also palpate one more time just at the liver's edge. Go ahead and take a deep breath in. And exhale. Okay, you're right there at the 1 centimeter mark. So a benign abdominal exam. The next thing I'm going to do is just percuss for any CVA tenderness. So for that, I can actually have you sit up. Actually, before you go ahead and turn over onto your right side. Okay. And just to ensure you don't have any splenomegaly, I'm going to find that trough space one more time. And I'm not able to palpate or percuss any dullness that would indicate that your spleen is enlarged.
Sweet.
Okay, here you go. All right, and then I'm gonna just percuss on both sides. Any pain?
None.
So no CVA tenderness there. Before we begin the musculoskeletal exam, I'm gonna just circle back and I'm gonna do some deep tendon reflexes.
Okay.
So your biceps reflex, so your C5, C6. Okay. Your brachioradialis. Okay.
I'm gonna move my sweater.
Okay,
Might help.
yeah. Okay, perfect. All right. C6, C7 for the triceps. Okay. So 2+ reflexes, which is an expected finding. We'll start first with the biceps. Reflex.
Oh, is that gonna,
Should
it's
be
all
okay.
bunched up.
Should be okay.
Oh, flex.
And then relax. Just let it hang. Okay. Brachioradialis. And triceps. Good. Gonna move on. We're gonna just test the patellar reflex. And looking here, I don't see any abnormal contours here. The alignment of her legs is straight from the patella down to the tibia. Just gonna feel a tap here. Good. And the other side. And then I'm just gonna flex here, test the patellar right reflex. Good. And the other side. Good. And while I'm down here, I'm gonna elicit the plantar reflex, make sure she doesn't have any Babinski. And her toes don't fan out, so that would be a negative finding. And just to finish off, we're going to do a musculoskeletal exam. So for that, you can actually stand up if you like. Okay. So looking at the anterior girdle of the shoulder, it's symmetric. I don't see any fasciculations or abnormal movements, any tenderness when I palpate here. Okay, and there's no swelling or deformity there. I'm gonna just look around to the back. You can turn with me. And the level of the shoulders is perfect here too. The scapular level, there's no swelling or deformity there. So turning back to the camera for your range of motion, if I could have you bring your arms straight up. Good. And down. Good. And then across the body. And the other side. And like you're itching your back. Good. And the other side. And to the back. And to the other side. And then just little shoulder rotations. Good. So normal range of motion. The patient had 5 out of 5 strength on her exam earlier. I'm going to next just have you do range of motion through your elbows. So flexion, extension, perfect. And then wrists, up, down, in, out, tiny circles. Good. And we already saw that you had good range of motion through your fingers in the previous exam. So 5 out of 5 range of motion. Looking, I'm going to turn just ever so slightly. Looking at the contour of her spine, you can see that she doesn't have any abnormal curvature. It's convex through the thoracic spine, is concave through the lumbar, palpating down the vertebrae. I don't feel any step down. There's no tenderness here when I touch. Her iliac crests are level. I don't see any atrophy through the gluteal folds. I'm gonna have you just bend forward like you're touching your toes. Good, and up. And if I can have you hyperextend ever so slightly. Good job. So normal range of motion there. I'm gonna have you turn to the side and just bend down like you're trying to reach something. And then to the other side. Okay, and then just rotate, truncal rotations. So normal range of motion there. For the next part, I'm actually going to have you back on the table. We're just going to do range of motion through your hips. I'll catch you with the pillow.
Oh, I'm gonna lay down?
Yeah,
Okay.
I'm so sorry.
No, you're good.
Okay, so we're going to start with just one of your legs. You can actually extend them all the way out. We're going to bring it up, okay? And then I'm going to have you sweep it across your leg. Go ahead and bring it down. Good. Across your leg like a windshield wiper and the other way. And then we're going to bring it up with the knee. Good. I'm going to do an internal rotation and an external rotation. And there's no resistance to passive movements. The patient obviously is flaccid. I don't see any spasms. Her legs are symmetrical in length. We're going to bring this other one up. Good. And down. Okay. And then windshield wiper across the body and away. Good job. Then bend at the knee. Internally rotate. And externally rotate, figure 4. Good job. Okay, and then while I'm here, I'm just going to circle back and elicit the abdominal reflex, which is a cutaneous reflex. I'm watching for the umbilicus to move in the direction of my stimulus, and it does. Have you sit up? We're going to finish with your knees, ankles, and feet, and you will be good to go, my friend.
Sweet.
Okay. Okay, just flexion and extension here one more time. Good. And there's no bowing or abnormal curvature here. I'm gonna have you one more time flex at the feet. Good, curl your toes over a pole and turn them in and turn them out in tiny circles. And that concludes my exam today. Do you have any questions?
No.
Okay, perfect.